Low potassium foods for kidney patients. Potassium is an essential mineral for human beings. Maintaining a healthy heart and strong muscles depends on this vital mineral. The baked potato with the peel on and the bananas are both excellent sources of potassium. But do you know that consuming excessive potassium might be harmful, particularly if you have kidney disease? It can lead to a condition known as hyperkalemia. It is a condition that develops when your kidneys are damaged and unable to filter excessive potassium from your body. Very scary, right? Well, don't worry, we have good news for you. You can take some simple steps to help maintain your potassium levels in the normal range. However, we advise you to talk to your doctor about lowering your potassium intake if you have chronic hyperkalemia. Moreover, we will advise you on a renal diet, or one that is safe for the kidneys. A diet that's low in salt, phosphorus, protein, and most importantly, potassium. Depending on the severity of renal illness, some people will also need to reduce their calcium and fluid intake. But first, why exactly do potassium levels matter? Because the kidneys are responsible for filtering the blood and getting rid of waste and extra fluid. These tiny powerhouses, about the size of a fist, can filter 120 to 150 quarts of blood per day, producing 1 to 2 quarts of urine. This aids in the prevention of toxic accumulation within the body. Moreover, it helps maintain average concentrations of electrolytes, including sodium, phosphate, and potassium. Those who suffer from kidney disease typically have poor renal function. In most cases, they cannot effectively control their potassium levels. Too much potassium in the blood is potentially dangerous. Potassium levels can become even more of a concern when using drugs to treat kidney disease. In most cases, high potassium levels develop gradually over weeks or months. This may cause you to feel tired or sick. If your potassium levels dramatically rise, you may have trouble breathing, chest pain, or heart palpitations. Contact the local emergency services immediately if you experience these symptoms. Hyperkalemia is a severe medical disease that needs quick attention. Now, what steps can you take to reduce the amount of potassium that has accumulated? Changing one's diet is one of the most effective strategies to prevent potassium accumulation. To do this, you will need to train yourself on the foods that are high in potassium and those that are low in it. Make sure you read the labels on the foods you buy. You should remember that the quantity as well as the quality of your diet is essential. To ensure that your kidney-friendly diet is successful, paying close attention to portion sizes is crucial. Consuming an excessive amount of any food, including those thought to be low in potassium, can cause dangerously high levels. Let us help you by telling you what to eat and what to avoid. However, before we start, remember that foods are categorized as low in potassium if they contain 200 milligrams or less per serving. Red pepper is number 1 on the list. Red bell peppers are excellent for the kidney diet for several reasons, including their low potassium content and rich flavor. Half a cup of red bell pepper has 1 milligram of sodium, 88 milligrams of potassium, and 10 milligrams of phosphorus. In addition to their delicious flavor, these vegetables are an excellent way to get vitamin C and A, along with vitamin B6, folic acid, and fiber. In addition, the antioxidant lycopene found in red bell peppers has been shown to reduce the risk of developing several types of cancer. Red bell peppers can be eaten raw as an appetizer with a dip, or as an ingredient in a more substantial dish like tuna or chicken salad. You can load peppers with ground turkey or beef, bake them as a main dish, or roast them and enjoy them as a topping on sandwiches for lettuce salads. Number 2 is cabbage. Green cabbage includes 6 milligrams of sodium, 60 milligrams of potassium, and 9 milligrams of phosphorus per half a cup serving. Like other cruciferous vegetables, cabbage is rich in phytochemicals, molecules found in plants that neutralize free radicals. In addition to promoting cardiovascular health and protecting cells from damage that could lead to cancer, many phytochemicals have been shown to have anti-cancer and antioxidant effects. In addition to being an excellent source of fiber, vitamin B6, and folic acid, cabbage is also rich in vitamin K and vitamin C. Due to its low potassium content and low cost, it can be easily incorporated into a kidney diet. You can include raw cabbage in your kidney diet by making coleslaw or as a garnish for fish tacos. It's a versatile side dish that can be steamed, microwaved, or boiled before being topped with butter, cream cheese, pepper, or caraway seeds. If you're in the mood for something fancier, you can load a cabbage with minced meat and bake it for a tasty, nutrient-dense meal like turkey cabbage rolls. Number 3. Apples. There is no sodium. 158 milligrams of potassium and 10 milligrams of phosphorus in a medium apple with a peel. Apples have been shown to lower cholesterol levels, stop diarrhea, fight against heart problems, and lower the risk of developing cancer. In addition, 1 apple a day helps keep the doctor away, since apples are high in fiber and other anti-inflammatory substances. This is terrific news for people with renal disease because they already get their fair share of medical appointments. This kidney diet champion goes particularly well with onions, the previous healthy food, in a delicious and novel apple onion omelet. Apples can be used in many different ways. You can have them raw, make baked apples with honey, stewed apples, make applesauce, or drink apple juice or cider. The next kidney-friendly food is egg whites. Proteins are the fundamental elements that make up the body. However, those with kidney disease need to eat it with caution and restraint to avoid adverse effects. Egg whites are an excellent protein source with a low potassium content, making them a great choice for kidney patients who want to enjoy occasional omelets and deviled eggs. They are also an excellent option for dialysis patients who need more protein but less phosphate and potassium. There are 110 milligrams of sodium, 108 milligrams of potassium, and 10 milligrams of phosphorus in 2 big egg whites. You can make eggs useful for breakfast, lunch, and supper by preparing them in various ways such as hard-boiled eggs, deviled eggs, smoothies, and omelets. Furthermore, egg yolks, cholesterol, and phosphorus content are higher. Therefore, if these nutrients concern you, it's best to avoid eating the yolk. Number 5. Strawberries. 5 medium-sized fresh strawberries contain only 1 milligram of salt, 120 milligrams of potassium, and 13 milligrams of phosphorus. The presence of the phenolic compounds anthocyanins and L-argitannins in strawberries is responsible for their beneficial effects on kidney health. Strawberries get their vibrant red color from anthocyanins, also potent antioxidants that shield cells from damage caused by free radicals. On the other hand, ellagic acids, or L-argitannins, have been shown to have a wide variety of positive impacts on human health, such as anti-inflammatory, anti-cancer, antioxidant, prebiotic, and cardioprotective qualities. Strawberries are high in fiber and contain significant amounts of vitamin C and manganese. These may give protection for the heart in addition to having anti-cancer and anti-inflammatory properties. Strawberries are a delicious fruit that may be eaten raw in a smoothie, salad, pie, or whipped cream. Then you can prepare a strawberry mousse, sorbet, or puree and infuse them as a dessert. And if you want a more involved dessert, you can also enjoy them with chocolate. Lastly, garlic. Almost every kitchen in the world has some form of garlic. Infusing food with its flavor while it's being cooked is a great way to make it even more delicious. In addition, it's been found that garlic has many health benefits for those with kidney disease. Vitamins and minerals found in garlic support healthy kidney function. 1 clove of garlic contains 1 milligram of sodium, 4 milligrams of phosphorus, and only 12 milligrams of potassium. A recent study found that allicin, a chemical obtained by crushing garlic, was effective in treating advanced renal illnesses. Garlic's diuretic qualities have also been studied for their potential to benefit kidney function. The kidney receives a signal to begin excreting any extra minerals or poisons in urine. Garlic is a nutrient-rich food with benefits for those with renal disease due to its antioxidant, antibacterial, and anti-inflammatory qualities. Kidney disease is commonly brought on by high blood pressure because of the damage it does to the kidney's blood channels. Damaged kidneys can't do their job correctly. Garlic's antioxidant capabilities help those with renal illness and those with hypertension by possibly decreasing oxidative stress on blood vessel walls and increasing blood flow. You can spice up your meat, vegetables, and pasta by getting it fresh, bottled, minced, or powdered. You can also spread roasted garlic on toast, and since garlic powder is a suitable alternative to garlic salt in the dialysis diet, you can enjoy the delightful flavor of garlic even while on a diet. So, if you're on a renal diet, you should consider eating these top kidney-friendly foods. However, always consult your doctor about your diet to ensure you eat the right things for your health. Restrictions on what a person with renal disease can consume range from mild to severe and from medication to dialysis. Even though sticking to a renal diet may feel like a chore, many tasty options may be incorporated into a kidney-friendly, nutritious, balanced diet. What other kinds of food do you recommend for people with kidney problems? It's helpful if you also suggest what to avoid eating when on a renal diet. It will help the people out there with kidney disease. Finally, we highly recommend subscribing to the channel for new videos. Many thanks for tuning in. Goodbye.